So please teach me some exercises for the sciatic nerve, the one that goes down the leg when the leg gets numb and tingling. In this video, I will show you how to manage sciatica at home using easy exercises. This video can help everyone, especially if you have an inflamed, irritated, or compressed sciatic nerve, or if you have a herniated disc in your lower back. And best of all, you'll see that you don't need to be young, thin, or very flexible to do these exercises and improve the health of your nerves. So, the sciatic nerve causes a lot of problems because it's the largest nerve in the body. It's a thick nerve. It's about the width of 2 fingers and runs down the entire leg. The exercises we're going to do here are meant to release the main points that compress, irritate, and even inflame the sciatic nerve. By the way, I never understood why people only think about the spine and the piriformis when the sciatic nerve problem can be anywhere in the leg. Anyway, let's start from the top down. The first compression point is in the spine itself. It's the foramen, that little hole where the roots of the sciatic nerve pass through. You will lie down on your stomach. It's important to keep your feet off the edge of the bed, the couch, wherever you are. Place your hands at shoulder level. They can be wider or closer together. Relax your spine. I don't want you to put any strain on your back. Just use your arms. Slowly stretch your arms. See how far you can go without forcing it, without feeling any pain. And come back. No rush. Many people feel the bottom of their spine is stuck, like it's just one block, like it's a single thing, with little movement. And that's exactly where the sciatic nerve comes from. L4, L5, and from the sacrum. You will do this 10 times without rushing. Throughout these 10 movements, it's as if we're releasing it, unlocking it, lubricating the end of the spine. You will do it 10 times, then rest and repeat this set 3 times. It's 3 sets of 10 movements. You'll see that when you finish, you'll have a different lower back. It's good for lumbago. The second point of sciatic compression is the piriformis muscle. But don't worry, we're going to release this muscle without any pain. I know some people who were traumatized by those deep massages, sometimes even using elbows, and they didn't solve anything. They just left us more sore. What we're going to do is gentle stretching. And then the piriformis will relax more and more, step by step, in a very comfortable way. You're going to stand next to a chair, place the foot of the leg where you want to release the piriformis on the chair. Slowly, you're going to turn to the other side. Keep turning your torso until you feel a pleasant stretch here in the glute area. Feel the stretch as if you were stretching when you wake up. Stop here. Place your hand on the outside of your knee. And without letting your torso return, keeping this position, you will apply a little force by pushing your knee into your hand as if you were trying to move your knee away. You will feel these muscles here waking up. If you feel any discomfort, use less force, okay? We are going to count to 5 and relax. Try to relax as much as you can, especially this area. Again, use some strength. Push your knee into my hand. Feel the muscles here in your glutes and butt waking up. And relax. If you no longer feel the stretch, just rotate a little more until you feel the stretch again. And repeat, use strength. Count to 5 and relax. You're going to do this 5 times with each leg. Here, besides the decrease in pain, the decrease in numbness, and tingling, you feel a warm sensation going down your leg. And that's the improvement in circulation that comes along with the relaxation of the deep muscles.
Turn a stone from red.
Almost 10 years here on YouTube, and this is going to be the first time I'm teaching this movement. And I guarantee you've never seen this exercise anywhere, not on the internet or outside of it. In Pu, what we're going to do is unlock all the compression points of the sciatic nerve in the knee and ankle at the same time. The sciatic nerve splits into 2 here at the back of the thigh, near the knee. One part passes near the head of the fibula. this bone on the outside of the leg. This is a very important area for the sciatic nerve. I think it's better to view the ankle from the other side. Here at the ankle, the two parts of the sciatic nerve. One passes behind the ankle near the heel, and the other passes in front. See, in front of and behind the ankle. Okay. The way to release all these points at the same time is to sit with your foot firmly on the floor. If you sit closer to the edge of the chair, it's even better. You're going to focus on the movement, paying attention to your little toe. Look, lift your little toe, move it away from the floor as much as you can, and then press your little toe into the floor as much as you can. You see that your ankle moves, but your focus is on your little toe. You're going to do this movement slowly, as much as you can. The biggest movement you can for 30 seconds to 1 minute. This will mobilize, lubricate, and release all those points where the sciatic nerve passes through. The head of the fibula up here, and the 2 points of the ankle, front and back. You will do this for 30 seconds to 1 minute with each leg. That made it even better. These 3 exercises we just did to release the points along the path of the sciatic nerve. You can do 2 or 3 times a week. You can even do it only on the leg where you feel pain, although ideally it's best to do it on both legs. Now, the next exercise improves the overall function and health of the entire sciatic nerve from start to finish. So it's important for us to do this exercise every day, especially while your sciatica isn't 100% yet. This is a neuromobilization technique. It's a technique used to release the adhesions we've accumulated throughout our lives. And the technical name for this is improvement of neurodynamics. You will look for a place near the wall, lie down. It can be a sofa, a bed, or the floor. I'm going to show you the most powerful way I know to mobilize the sciatic nerve. So pay attention to the details, okay? This technique will be a little different from the others you've seen here on the channel. The first step is to lie down near the wall. Second point, keep your head elevated. So you can use a pillow, 2 pillows, or that wedge pillow, right? That triangle pillow. The important thing is to keep your head elevated. Legs bent, 1 leg. You're going to stretch it out and rest your heel on the wall. Can you see the foot? Yes. Pull your foot towards you like this. Make this movement. See what you feel behind your leg. If you felt pain, if it pulled too much, if it's hurting, it's because you're too close to the wall. In that case, move away. If you, like me right now, didn't feel anything, no, stretch. It's because you're too far away. So let's get closer to the wall. Hold your heel, keep your knee straight, and pull your foot. Now feel the stretch. In this pain-free stretching position, you're going to make that movement with your foot. Point, flex, stretch, bend. Stretch, flex your foot. Do this slowly, no rush. 60 times stopping whenever you feel tired or if your sciatic nerve starts acting up. Start to feel sore, start to feel numbness, tingling. You lower your leg, wait for the tiredness, pain, numbness, and tingling to go away. Then you go back and complete the 60 movements, 60 times with each leg. Want to improve even more? There are muscles that, when they build up tension, mimic sciatic pain. I'll show you an easy way to help this muscle in this video right here. Just click here on the screen. And if I managed to help you today, thank me by sharing this video with someone who has sciatica, feels numbness or tingling in their leg, or has a herniated disc in the lower back. That's all I ask. Make sure this video reaches those who need it. That's it for now. Take care and see you next time.